Because every woman's health matters and every child deserves a healthy start. Join us on Mother and Child every first and third Monday at 10:15 a.m. A specialized health program dedicated to the unique health needs of women and children with a primary focus on maternal wellness, pregnancy care, safe delivery, nutrition, growth, child health, and early prevention of common health conditions. Each episode is designed to inform, educate, and gently guide mothers and caregivers in making the best health choices for themselves and their children through trusted medical information, expert voices, and practical guidance. Every first and third Monday of the month on Mainland 98.3 FM at 10:15 a.m. We bring the very best of medical expertise, and so if you're an expectant mother, a new parent, or a caregiver, Mother and Child is a trusted companion on your family health journey. Mother and Child, caring for mothers, nurturing children, and strengthening families.
Good morning once again. Welcome to Mother and Child on Mainland 98.3 FM. This is your trusted space for conversations that shape healthier families and ultimately stronger communities. And just like every other day, we would be focusing on health conditions, whether it be physiological or psychological, as it affects women and children or practically members of the nuclear family, because of course the family is the smallest unit of society, and so we need to speak to health manifestations that happen within that structure before it becomes a broader concern. And that's what Mother and Child is all about. And today we're going to explore a topic that sort of centers around health, adults and children that are living with disability within the family structure, and talk about the barriers that they face in accessing quality healthcare, education, social opportunities. And these challenges are often not even due to their conditions, but we have systems that were not even designed with these persons in mind. Sometimes delayed diagnosis, stigmatization, even access to certain buildings, persons with mobility issues and how they're able to enter into a building. There are no ramps, amongst other things. And so we want to have a conversation around the lifetime consequences that these often pose for the individuals who suffer from this condition, especially the mothers, the caregivers, and even the children themselves that deal with this condition. So we're taking the conversation from awareness to inclusion. We're talking about, it's not charity now, it's about fitting people into systems to design systems, not even fitting them in, to design systems that actually work for everyone, right? So today on the show, we'll be exploring different angles. How do we build a healthy system that leaves no one behind? How do we ensure that inclusive care can become practical? How can families, professionals, policymakers, how can we all work together to create a society where every child, regardless of their ability or inability, can thrive? And for this conversation to unpack the conversation around neurodivergence and disability inclusion, we have an advocate who is a neurodivergence and disability inclusion advocate. She's the founder, daughter of Alien Support and Empowerment Initiative, and she is our guest for this morning. She joins us via the phone. Her name is Eyvonne Eleko. Good morning, ma'am. A pleasure to have you join us on the show today.
Good morning. How are you doing today?
I'm well. Thank you very much for joining us. Now, let's get into the conversation. First of all, I'd like to open with your own personal experience before we talk about the complexity of the issue. Why did you choose this path? I know that medicine and advocacy, healthcare is really broad. Why did you decide? Was there a defining event or moment where you thought to yourself, this is the path that I would like to set on? I would like to be the voice. I would like to be the face and advocate for people who deal with certain health conditions, especially neurodivergence, and those who deal with certain disabilities or the other.
Absolutely. So I think this is something that came out of my own personal experience. It wasn't something that that happened as a one time or a single moment, right? It was a pattern that I kept seeing over time. I've encountered families who were dealing with neurodivergence or disability in silence, especially here in the diaspora. And for me, there was a lot of confusion when it comes to the misinformations, and in many cases, shame. And what stood out to me was the issue wasn't just condition itself; it's how the society responded to it. So, and I also saw how much of a difference the right information and support could make. So, when parents understood what's happening and they felt supported instead of judged, everything just shifted for that child. So, for me, the decision comes from recognizing the gap. There are not enough conversations being had around this subject, and not enough safe spaces for people to even be able to come out to have practical guidance for families, especially within our communities. So I think at this point it became less of a choice and more of a responsibility, especially being a neurodivergent myself, and the misunderstanding that people say, oh, but you're normal, but you look, you're a functional human. And I'm like, Dad, I don't understand you. It's not a disease. It's not some sort of form of issues or conditions, right? So it's just some conversations that we have to have. And so those moments kind of stood out to me. And I know how much of right information could make a lot of difference.
Would you say there's a difference in the experiences of those who are neurodivergent and those who often have to deal with physical disabilities, right? For example, mobility issues, cerebral palsy, for example, and those who are neurodivergent, I know, conditions like ADHD, autism, amongst other things. Would you say the experiences are very different, or is still under the same umbrella?
I would say very much so, right? Because every child or everybody in general is going to perceive the world differently, right? Mm-hmm. So even though they might seem like they're all under the same umbrella, but the experiences can be quite different. Neurodivergence is a very broad term, and it includes, like you mentioned, ADHD, autism, dyslexia, and all that, right? So what they share is that the brain processes information differently, and which is from what is considered typical. But how we show up every day can vary a lot, right? So a person with ADHD might struggle with attention or impulsivity, while some who has cerebral palsy, of course, it might just be a different issue entirely. So conceptually, the support each of these person needs would definitely be different, and it's not going to be a one size fits all. So, and when it comes to societal acceptance as well, obviously we can see how people refer to these issues, right? So I think it's going to definitely be different for everybody, absolutely.
I'm glad you spoke about societal acceptance of these situations, and I think we can start with the family in itself. Now, a lot of medical practitioners and also advocates as yourself would say that oftentimes one of the biggest challenges they face is even getting the family members or the guardians to accept the condition of that child. Delayed diagnosis, they do not believe that this is a neurodivergent situation, right? A child who's extremely hyper, unable to complete a task, sometimes it's ADHD, but they just think that child is stubborn. And then when you tell them that this is a condition, this is ADHD, they start to, I rebuke it, I reject it. So let's talk about that, why there is a lack of acceptance, especially with the immediate family, with the guardian, with the parents, when they're being told that some of the signs that your child or your offspring is exhibiting might be, an indices of a neurodivergent condition or maybe even a disability.
I would say that the challenge is very real, and it's like you mentioned earlier, is more common than what people think, right? And I think a big part of that resistance comes from fear of misunderstanding. And for many parents, hearing a label like ADHD, autism might feel heavy for them because it's, like you said, it can feel like something that is being placed on their child, and their first instinct is to protect that child from anything that like limiting or negative, right? So there are also cultural sides to it. In a lot of homes, you have behavior, and that is still viewed through a disciplinary lens rather than developmental issues. So if a child who is very active is seen as stubborn, a child who struggles to focus and is seen as lazy might be withdrawn. And I would say that the factor here is stigma, right? Some parents worry about how their child will be perceived and how the family will be judged, or what it would mean for the child's future. So I think hypothetically speaking, from coming from a very protective standpoint, it's more to them. It is better to reject the label that can feel like, which feels like a way of protecting both the child and the family. And that's why we're having these conversations where we want to make sure we're removing the stigma to continue to enlighten the society, so that there's a lot of awareness and education around conversations like this, to make sure that parents understand that it is not, it's not a stigma. It's actually worth celebrating, honestly.
All right. Well, if you're just joining the conversation, we are here talking about neurodivergence. We're talking about inclusion. We're talking about how we can advance equity in health systems and also in society. And my guest is Eyvonne Eleko. She's a neurodivergence and disability inclusion advocate, also the founder, daughter of Elin Support and Empowerment Initiative. And we're looking at this from the perspective of all the factors that come to play. Let's have a conversation about the stigmatization that you even mentioned. Now, especially in children, they're young. They might not have an understanding of the depth of the condition that they're dealing with. All they want to do is socialize. They want to play with their friends. They want to learn in school. And oftentimes, once the diagnosis has been accepted, there's the fear that if other children know that my child is experiencing this, or if the teachers notice, there sometimes might be, a knee-jerk reaction of isolation. Oh, don't play too much with her. You might push her. She might fall. She might injure. She might not understand what you're doing. It might come off as aggressive. Do you think that sometimes in trying to protect these children who are special needs, that we in a way think isolation is the best approach? And what is the consequence of that notion?
Oh, that's a very good question. So I would say honestly that oftentimes, again, I mentioned earlier, it comes from the parent protecting the child and not necessarily meant to harm the child, right? So when parents and teachers and even other children are trying to be careful, sometimes that protection can turn into overprotection. And that's where the problem starts, right? When a child is constantly separated or told to stay away, what the experience is not safety, it is isolation, like you mentioned earlier, and the consequences can be significant. Socially, the child might miss out on a lot of learning how to interact and share things, or even communicate and build friendships. So the key thing here is also the education, to make sure that the society understands that it is, again, I mentioned earlier, it's not a disease that needs to be avoided, where you have to isolate your child. It is it's a developmental difference that needs to be understood. And I think when we start having these conversations, and teachers particularly, educators and parents particularly, understand that, maybe it just puts things in a better perspective, rather than seeing this as a disease that needs to be cured. As you mentioned earlier, a condition, right? But it's not a condition. It is, we have neurotypical, and then we have the neurodivergence. The best way that I like to explain it to the parents that I work with is, you have your Android phone and you have your Apple phone, right? Both of these devices are not going to have the same operating system. So see the population of the society being Android, and then your child has an operating system of an Apple phone. They're still going to work, and they're still going to do what you want them to do, but the operating systems are going to be different. And the earlier we start celebrating that difference and accepting that everybody will not operate from, the better for the society, actually.
Well, what would you say are the most physical symptoms, or let's say signs, that a parent or a guardian can look out for? You've spoken about, I'm pretty certain that you've worked with a lot of children and parents, children who are neurodivergent. What would you say are some of the most telling signs that this is a child with special needs, and we need to start making moves to ensure that they also can enjoy a seamless life, at least to the best of your ability? What would you say are some of the most telling signs that this is a child that is neurodivergent or is on the spectrum?
I think it's, as a parent, I think it's paying attention to those developmental stages and consistent patterns. the milestones. Every child is not going to develop the same. They're going to develop differently. But when certain behaviors keep showing up, that's when parents should start paying close attention to them. And some of the telling signs as a parent that you can look out for would be when it comes to communications. Are this, do they have delayed speech, or they have very limited speech for their age? Are you when you call a child's name, are they responding to their name consistently? Do they have difficulty expressing their needs or even understand simple instructions? And when it comes to social interactions as well, we're talking about limited eye contact, which, most people might say, oh, she's just, or he just doesn't like people, right? Do they prefer to stay alone most of the time? Do they struggle to engage with other children or share attention with behavior routines as well? Some children might have repetitive movements like like hand flapping or rocking or lining up objects, and some might even have very strong attachment to routines and distress when things change, right? Or when routines changes. So, and so some might have they might be very focused intensely on certain special interests. So it's a bunch of factors that we have to, as parents, start paying attention to from that very early 6 to 9 months, and you have to start paying close attention to this. So overreaction or underreaction might sound like it's an issue. Some textures and lights and even touch. So it's just paying attention closely, actually.
What would you say are some of the biggest challenges that the children or even young adults with these conditions often encounter? Would you say is lack of care? Would you say is inaccessibility to even the available care? Do you think it's mostly financial? Do you think it's a problem with the policy? Or do you think it's a lack of skilled professionals within even the academic system, within the household to help manage them? What would you say is the primary challenge that these children often experience, as well as the caregivers?
So for this question, I like to think of it more of, it's not just one issue, right? It's a combination of everything that you've just mentioned. But I would, it's the primary challenge is the gap between need and support. There are children who are going to need support, and there's simply, and that simply is not enough. Like you mentioned earlier, the educators, right? Educators in Nigeria are typically, they're trained to be able to cater to the neurotypical minds. So when you have a neurodivergent child who has to learn in the same condition, are we giving them the same accommodation that are required or necessary in order for them to be able to understand things like their peers? And when it comes to adults as well needing support, there are companies that do not even understand or recognize that you might be neurodivergent, and so you need accommodation to be able to work. And in a society like America or the United Kingdom or any Western world in general that have been able to recognize these things, they are able to, companies are able to give you accommodations where if you're overstimulated, you might get noise cancellation headphones. You might be put in a room where, you might be able to work in a room where the light is too harsh. They make a lot of accommodations around these. Now, when it comes to professionals, right? There are several professionals, but then they're just not enough, right? Especially within schools, especially even medically, it's just not enough. And when it comes to the policies are there, but it's just we still have some gaps. And inclusion is often we talk about it a lot, but most of these policies are not fully implemented. And so we need to do, as a society, we just need to do better.
All right. Well, thank you very much. We'll also move to conversations around policy makers. At the moment, do you think that the right policies are in place, or you think it is the poor implementation? And by poor implementation, I mean the policy makers are just that, policy makers. At what point in the structure do you think the policies are not implemented? For example, I know that in Lagos State, there's the law that says that all public buildings must have a ramp to allow for those who have mobility accessibility issues to access the building, but it's a number of buildings that do not have ramps, that do not prioritize it. So I gave that illustration to sort of guide the response that I'm hoping to get. So is it really just the policymakers or the individuals who have ignored that policy by virtue of the fact that I run a private institution and I don't have to make certain provisions, available for certain individuals just because a government says so?
I think you said it perfectly. Honestly, I think it's we have the policies, they're there, but the accountability and the implementation is where it lies. Organizations, private organizations, or even public organizations are accountable or held to the standards where, as you mentioned earlier, buildings are not enforced to have the ramps for persons with wheelchairs, or buildings don't even have elevators for people who cannot go up a flight of stairs. So I think these policies are there. We're just not implementing them. And when it comes to implementation as well, individuals and organizations are not being held accountable for the lack of implementation.
What sort of education system adjustment would you like to see? There are a number of schools that accommodate children with special needs. I've been privileged to talk to a number of them, but it's not a lot of them. There are millions of children who are neurodivergent, who suffer from certain disability. Dyslexia, for example. A child who suffers from dyslexia being in the same school or a school without a skilled professional might be lagging behind in class, and oftentimes they would just ignore this child, or how insensitive we can be as Nigerians and start to tag them and olodo, if you know what I'm talking about. But this is just a child who is slower to process. It doesn't make them unintelligent. So if we were to adjust the specific sector, which is the education sector, to accommodate these children, what exactly would you think would be the first step in the right direction?
I think the first step is understanding that the one way of learning is not working. It's leaving a lot of children behind, right? Like you mentioned earlier, they're being perceived as olodo, but then every child has that be able to harness. So first, it will start with basic training for all educators, not just to turn them into specialists, but for them to also be able to recognize the signs that, some children might be dyslexic, some might have ADHD or autism, and any simple classroom adjustment will go a long way. A person, for instance, a dyslexic child might learn better when it comes to, when you introduce right? When you introduce visuals, when you introduce audio, they learn better that way. So they might be able to read and write, but they will definitely they understand when you introduce audio files or visuals into the conversation, and just early education in schools, removing, like you said, harmful labels like olodo. These are things that do real damage to the child's self-esteem. And once a child is labeled that way, it affects their confidence and how they even, see themselves and the mindset. So I would say training and providing the accommodations in our classrooms.
All right, then. So let's also talk about how we can teach other students in the school, because we talk about skilled professionals, that's the teachers, the educators, the guardians, but these children would also interact with other children. And again, we need to understand that they are children. And so as much as it's difficult for even the child who's neurodivergent to fall into their own reality, we also should expect that the other children would need time to process what is happening with their friend. So how can we communicate with these other children in a language they would understand, that he's a child like you, he's just a little bit different and processes things different than you? It's not a problem. How do we find a way to create that environment where they can all just be children regardless of their neuro differences?
So it's such an important question, right? Because again, the inclusion doesn't just start with the adults; it also happens to children. And the truth is, children are careful. They're actually very open to understanding if we explain it in a way that makes sense to them. So, how do we communicate this? I would say first we keep it simple and relatable, right? Teaching, let children understand, and by saying something even as simple as everyone's brain is different. the same mold. I think that's the simplest way to even start that conversations, right? Some people are going to run fast, some are not going to, some are not going to run at all, and some people might need a bit more time of, to understand things. Your friend just learns in a different way, and this removes the fear and just makes it normal. Now, and we also talk about modeling behavior, right? Children learn a lot from what they see. If an adult is constantly referred to Olodo, you're going to hear the child, the other kids also call the same child Olodo, right? So, so if a teacher or adults around parents or they're inclusive and they're respectful and they understand that every person deserves dignity, children are able to model that. And we need to be able to allow classrooms, right? Let's all play. Let's show you how you play together. Give him a little bit of time to respond. You can take turns. If he gets overwhelmed, we can pause and try. But, these are things that I feel like if we create that culture, we will be able to implement that in our classroom.
All right. I know you already mentioned in passing when you were analyzing the other questions I had posed, but what would you say are the biggest misconceptions, right, about children who are neurodivergent and children who suffer from disability? What are the most darning narratives you've heard about it? And I'd like you to take the opportunity to correct these notions.
I think it's the notion that, somebody might say, but the child looks normal. And what I always like to explain to people that work with this, that's why it's called a spectrum, right? Most people or a lot of people are on the spectrum and they live their day lives and people don't even know. And so, and also tagging people the spectrum as, they're slow or they can't very darning categorizations. A lot of inventors and the millennials today are on the spectrum. So when you say, child is just stubborn, child is just stubborn or badly behaved, whereas child is just with I can pray it away. The child will give it time. Caused by bad parenting or lack of discipline. So, or some say, they should be separated from other children. These are all mindset that I concept. And so for me, it comes to trying to what people understand. But when we face assumptions with accurate information, the response to the child actually changes completely.
All right. Well, as we have spoken about some of the issues that are often encountered, how then do we start to rectify it? Because earlier in my prologue, I had mentioned that it's not about trying to fix these children into systems that have already been designed. It's designing systems with them in mind. So we're not trying to adjust for them to sit down. We're creating a system where there is already a place for them to sit. So how do we do that sort of structural adjustment? How do we create a society, even with transportation, with the school system, social activities? How do we start to design systems that actually accommodate, children who are neurodivergent and also those who suffer from one form of disability or the other?
I agree with that framing completely, right? And as you mentioned, the goal is not to adjust the child to fit the system, but to design the system that already accounts for different ways of learning and functioning. And to do that, we have to move from awareness to structure. And what that would look like in practice would be to build flexible systems, to build flexible systems and not as an exception, right? So like we're looking at our classrooms and workplaces and public spaces, they should not just have a one way of doing. For example, in schools, that means multiple ways to learn and demonstrate. I mentioned earlier understanding that some children might learn with visuals and some will learn with audios. Maybe we start by providing these and in our classrooms so that it gives such children the opportunity to be, to at a better life and education as well. And of course, we have to train people inside the system So policies don't just implement themselves. We have to make sure that everybody's being accountable, and we're holding ourselves to the standard. That also means that when we're designing for inclusion, we're not fitting, right? Like the example of ramps that we gave earlier, it should be a standard. It should be standard. You don't even have to have that disability. People have accident and they have to use crutches for a couple of months. How do they access buildings? We have to start thinking about it and shifting the mindset from special to expect, right? It's not special for you to make accommodations for other people. It is at a standard human, dignity and respect. So it has to become a part of that. The key point here is the structural change. Structural change can happen when inclusion is built in.
Hello?
Yeah, can you hear me?
Okay, yeah, there was a break there. Well, for those of us who were part of the conversation, we appreciate you for your time. I know that, from 45 minutes would never be enough to talk about the situation as critical as inclusion, especially in Nigeria. Unfortunately, as much as we can commend the work that the government, private organizations, NGOs are doing to allow for inclusion, is still not enough. We're over 250 million people, and you'd be surprised of even many people who are still undiagnosed at this time. Many children who are locked up in some place and they're casting and binding demons away from them when all they're suffering is just a condition that proper treatment, proper management would help them navigate. As we close the discuss, Eyvonne, Eleko, I'd like to get your final words. Assume that you're speaking to somebody who is ignorant, or perhaps don't even know that they're ignorant, a person who has a child who's neurodivergent, a woman or a family who's taking care of a child that has a disability. What would be your message to them?
I will say my closing line would be to when inclusion is designed into the system, no person or child has to fight for a place within it, right? So common human dignity and respect, and giving everybody a chance, and celebrating every child's brilliance irrespective of their developmental stages or phases.
Well, thank you very much. We appreciate you for your time. My guest today was Eyvonne Eleko, neurodivergence and disability inclusion advocate, founder, daughter of Elin Support and Empowerment Initiative. It was indeed a very interesting conversation, and hopefully it has the impact that we're hoping it would have on those who have been able to listen. You have a great day. Thank you for your time.
Thank you for having me.
Well, that's where we draw the curtain on discussions for today. We spoke about disability inclusion and how we can create health systems that accommodate people who have disabilities, mobile disabilities, they're visually impaired, people on wheelchairs, for those who have ADHD, who suffer from autism, who are dyslexic, who have a hard time, who have sensory issues, for example, and also the caregivers, because trust me, an average Nigerian family that's taking care of a child who has a disability, whether it be, as I said, physiological or psychological, it can take a toll. We've seen a lot of families drift apart. We've seen divorces happen in households that have children with disabilities. So this is something that is at the center of our everyday living as a society and as a country. And so it's important that we talk about these things. We need to talk about the provision of care for them, and the fact that we often attribute a lot of these things to spiritual issues. I know we're a highly religious country, but sometimes there's no amount of flogging and demon casting that would help that child. What you need to do is take them to a trained professional to help you with a diagnosis, tell you what medication they need to be on, and also what sort of social environment you need to create for them to thrive. They're just different. It doesn't mean that they're not persons. They operate differently, and there is beauty in diversity depending on how you're able to manage it. And that's not to minimize how much effort it takes for caregivers and parents, especially of those who have children that fall under this spectrum. My name is Sage Babalola. Thank you so much. It's been quite the discuss from the morning up until now. Even despite the disruption, we were able to find a way to make it work, but we should say thank you and salute your patience whilst we were trying to navigate that. We're going to step aside very briefly so we can have the next bit on the next rounds of conversation come on air. Victor Ajibong should be here for the handover session. We have the Mainland Business Cafe, we have Mainland Metro, we have the news at noon, and I'm pretty certain when my colleagues come up here, they would again give you the rundown for the Launch Cafe segment of the programs that we have lined up for you. I'm Sage Babalola. It's Mainland 98.3 FM.